The health department in Limpopo has sent a team of healthcare professionals to administer Bilharzia's treatment, to 142 pupils from Malwandla Primary School. Now, last week, the department sent a mobile clinic, a team at least, to conduct tests after parents and teachers suspected that the pupils at the school might have this condition. For more on this, let's speak to the department spokesperson, Shikwambana, who joins us via our video link this morning. And Neil, thanks for your time. It's great to have you on the program, albeit on this particular story. You heard me struggle there with the condition, and I suppose it's because not many people know about it. But from what I've been able to glean so far, it's caused by a parasitic worm found in fresh water. Tell us a bit more about it and how you suspect these children may have contracted it.
Thank you, Ayanda. So the condition or the suspicion from the parents came after they were notified by the teachers at school to say they see a lot of blood stains on the toilet seats because one of these symptoms of Bilharzia, it's discharging blood after urinating, blood-like stains after urinating or discharging your stool. So the teachers at school witnessed this in the bathrooms and alerted parents, who then made contact with us. We immediately sent a team of healthcare professionals to go and conduct tests, and the test results came in yesterday and indicated that out of the learners, 142 have actually tested positive. As you've already indicated, this condition is actually carried by a virus that is found mostly in contaminated fresh water, like your rivers, dams, lake, and so on and so on. So working with the stakeholders there, the Water Service Authority, we're conducting water tests to check the water quality and also to see if we can intervene in ensuring that we keep the quality of water acceptable in that particular area.
Yeah. So did you test all the pupils, Neil, or just the ones who were, who had symptoms? Because my understanding is that, in fact, the symptoms only show several days after you've contracted this particular disease. In other words, you may very well have pupils who've also contracted it but aren't showing symptoms yet.
So up to this far, we are not so sure as to the source of the condition, but there are two things that we're suspecting: either the borehole water that is being used at the school, because there's no bulk water supply to the school, they use the borehole. But then again, there's an adjacent river next to the school called the Chindele River, where probably some of these learners might have gone there to swim or fish or do other activities there. So we have actually tested all the learners at the school just to make sure that we don't leave anyone behind, and also taking into account the issue of the issue that we are raising with the showing of symptoms after days. So all learners were tested, and the results came in showing that 142 learners have tested positive. So the testing will actually continue, because once we also understand the source of the water, let's say for instance the results come and say the contaminated source is the river, it would then mean that the scope should broaden up, because it would not only affect the school learners, it could also be parents who might go there to wash their clothes or wash their cars, or those who are heading cattle might have passed through the river, and many others. So for now, because we saw these symptoms mostly at the school, we've tested the learners just to make sure that we contain that space. But once we get the test results of the water quality from the Water Service Authority, then we'd know how to increase the scope of testing.
Right. Severe cases of the disease, we're told, can be fatal. How are the pupils doing?
Currently, we do not have critical cases that have been identified, except that they were showing those symptoms of urinal blood stains, which are being contended. As we've already indicated that today we're sending a team who would administer medication to them and continue to monitor them and see what actually transpires from here. But so far, we think the situation is under control.
Okay, that's good to hear. Nonetheless, we're told that this kind of parasite that infects the human body may take days before it's completely eradicated. How is this likely to affect teaching and learning in the school? And I understand you speak for the health department, but I'm sure there is some kind of coordination between the two in order to make sure at the very least that you do keep this situation under control.
Yes, of course. You would know that also as the Department of Health, we've got a team that we call School Health Program that we do working together with the Department of Basic Education. So the collaboration is already there just to ensure that whatever happens does not actually disrupt the learning process. As I've already indicated, our healthcare professionals will continue to monitor learners at that school and also other schools in the surrounding areas as well. Because if, for instance, I've already indicated if the contamination is in the river cuts through a number of villages which might have schools downstream and upstream. So we're also doing intensifying our awareness campaigns in the area just to make sure that people are well aware that we've got this challenge that we're seeing at Malwandla Primary School in Petaneng, which might actually be existent in some parts. So we're increasing our scope and also widening our awareness messages to ensure that we reach as many people as we can. So, and also encourage parents to say if they see anything of the symptoms, either on the kids or that they should quickly visit their nearest healthcare facility, because this is an infection that can be easily managed once it's discovered during its earlier days.
Yeah, and I suppose, Neil, it's worth going through some of those symptoms again, especially if parents are worried that their child might be affected. You did mention, I think, headaches at some instances. It affects the urinary traction of the children as well. What should parents look out for?
Yeah, so in the main, the most common symptoms are those ones of the bloodstains, like on the after urinating or passing stool. But you've got others like which actually it might be indicative of other infections, or which might be confused of other diseases, such as headache, as we mentioned, fevers, and so on and so on. So we just want to actually encourage parents to say they should not sit once they see this kind of symptoms on their kids. They should send them immediately to the nearest healthcare facility so that a proper diagnosis can be made and treatment be administered immediately.
All right, Neil Shikwambana, thanks very much indeed for speaking to us. It's great to hear the situation is largely under control, but of course you'll understand, quite startling the first time one engages with the details of what happened. Neil Shikwambana speaks for the Health Department in Limpopo. 142 pupils from one school there having had contracted Bilharzia. It's a disease found in mostly contaminated fresh water, causing all manner of symptoms, including, as you heard there, infection to the urinary system and when you pass stool. We'll continue watching that story, hopefully catch up with the education department as well to get a sense of how they're responding on their side.